Hello and welcome to From Dreams to Reality, a Business Tale podcast interview series. I'm your host, Jerry Cavella, and today I am joined by the amazing Dr. Andre Gomez, President and COO of Bedrock Healthcare, founded in 2021 and headquartered in Edison, New Jersey. Doc, let's do this. Welcome and thank you for taking the time out of, I know what is a busy day. Why don't you take some time, kick off the conversation by telling us a bit more about you and what is truly an amazing business venture?
Wow, Jerry, I am humbled by the introduction. I really appreciate your time as well. Listen, it's a dream come true for me. Again, an irony of this podcast to be able to discuss with my colleagues and my new colleagues the great work that Bedrock is doing. But I'll start with a little bit about myself and I'll kind of integrate into what we're doing as a practice. I'm a middle child, Jerry. So I think since birth I have been forced to sometimes be the arbiter between my older and younger brother, and I've really have been forced, I think, inherently to be a contrarian, right? Because I had to deal with my older brother who wanted to go one way, my younger brother who was the baby. He was the one that took a lot of the kid gloves, and always the middle child is the person who needs to kind of take the brunt. So for I think inherently, I've always been very that much the contrarian, always looking for solutions, always trying to be very resilient in the way I went about everything. And in my professional career and in healthcare, I've been no different. I've always tried to look at both sides of the picture and constantly trying to see how can I maximize, how can I make it better, how can I improve the outcome of our patients. And that passion and that mission to really change healthcare, really change the outcome of our patients, identify that what we're doing isn't working. It's not working for the physician. It's not working for the patients. It's only working for the insurance companies, right? We sit right now in a time where the reimbursement of a physician has decreased by almost 80% compared to 25 years ago. But yet insurance reimbursement has increased by 314% by last count. So there's an inverse relationship in what the physician is getting paid versus what the insurance company is getting paid. And what can venture to say that with that increase in reimbursement to the insurance company, healthcare and physician decisions have actually gotten worse. Physicians are spending less and less time with their patients. They're having to do a lot more digital bureaucracy. They're having to do a tremendous amount more paperwork. And just the cost of doing business, especially in this inflationary period, which again, everything just costs more money, and patients are choosing between food and shelter. And they're prioritizing that above healthcare needs. It's really very difficult for us to provide healthcare. So for me, I've always tried to improve the outcome of patient care. I've always tried to improve that relationship between our patient and our provider. And at no point in time, Jerry, did that become more galvanized and more of a need and more of a sense of urgency for me than it did during the pandemic. The pandemic really changed the way that I looked at healthcare. And I think it looked at the way that all of us saw healthcare forever. And that's the time where we decided that we were going to bring Bedrock Healthcare home to life. That was really the birth of our mission. And what is Bedrock Healthcare at home? We are a multi-specialty medical practice that encompasses every aspect of the healthcare continuum under one umbrella. So we have a medical practice that has physicians, nurse practitioners, physician assistants. We have a therapy practice that has PT, OT, and speech. We have a population health team that does all of telemonitoring, remote patient monitoring, chronic care management, behavioral health integration. We have a home care team with LPNs, RNs, social workers, exercise physiologists. And our mission is to optimize the patient journey. We actually called ourselves an ecosystem. And we recently rolled out a term which we are really going to use to really reframe what we do. We are officially, Jerry, Bedrock Health. And what is health? Health is we are a healthy ecosystem that is advancing life through healing. A healthy ecosystem advancing life through healing. That's what health is all about. And for us, We are the multi-specialty medical practice that is disrupting a very archaic healthcare model. We are looking at the patient the way that the patient should be looked at now, meaning that our patients have chronic care needs. Patients over the age of 65 have two, three, four, five, six different chronic comorbidities, but yet we are providing healthcare on an episodic level, meaning that we see them and then we see them again for a couple of months and they only get worse. And again, just an observation, Jerry, when we see patients, when they're sick, they only get sicker. So our mission is to see patients not episodically, but continuously. And when you see chronic care ill patients continuously, when you see them on an ongoing basis, when you see them when they're well, they only stay well. They only continue to optimize and have dignity. There's one statistic that I really want to make sure that I impress on the audience today, and that is our out of a $4.3 trillion in healthcare that we allocate every year, 90% of those healthcare dollars are used in the last year of life. And that tells us, Jerry, that we have a reactive, illness driven healthcare system that's not focused on primary care. It's focused on reactive care. And our patients are having to use urgent care and the emergency room as primary care. We have a population that is getting older. We have the silver tsunami that has us having to take care or more people with less dollars to go around. We have an inflationary period. We have a time where patients are choosing, again, other things to take care of and pay for rather than healthcare. So it's an unsustainable model. And we are the solutions. And one thing that I am very, very passionate about is the fact that we have created a system that takes less finances to operate, meaning that we are seeing patients on a value-based basis. So we're able to eliminate the frivolous aspect of healthcare, not seeing patients over and over and over again, and basically incentivizing the insurance company and sometimes the provider to have patients get worse. Because the more frequency and duration that I have with the patient, the more I get paid. No, we are presenting to anyone that will listen and anyone that will see that if you take care of someone ongoingly, continuously, if you actually take charge of their health before they get sick, you actually provide a better outcome for less money, which is a win-win situation across the board. And we're finally will be able to really get a grip of our readmission stats, which are the biggest deficit that we have in healthcare. On a general basis, Jerry, readmission rates from hospitalizations range between 15 up to 33%. Our medical practice, our multi-specialty medical team, using again providers and also adding technology where necessary, it has allowed us and empowered us to reduce the readmissions of our patients down to 2.1%. And that's what I call success, Jerry. Not making money in healthcare, but providing value and letting the clinical aptitude of our services provide that monetary gain. And for me, there's no shame making money in geriatrics and in healthcare if you do it right.
Doc, you're certainly shaking the foundation of the current medical system. What's the response been as you introduce this disruptive model? I know you said that in a way you're a disruptor to the system. What's the response been like for you?
That is a great question. So the people that you would expect to be in line, right, with or embracing this disruption, so the patient, they have embraced us dramatically well. Our partnerships, right? So where we provide care, the hospital, the assisted living communities, the long-term care communities, our skilled nursing partners, they have been nothing but welcome, and so have our family members. The resistance has been in the archaic dinosaurish mentality of our colleagues, our other healthcare providers that are acting like the pandemic never happened, that are acting like the pandemic was just a blip in the map and I'm going to keep doing business as usual. People who continue to be frustrated with the reality of healthcare but do nothing about it. I don't know if this, Jerry, but 82,000 physicians left medicine last year. And something like 70,000 more are going to leave this year. Something like 300,000 nurses are leaving healthcare. There's mass exodus right now. because between the pandemic, the post-pandemic recovery period, the toxic work environment, the decrease in insurance reimbursement, the decrease in compensation, and just the very volatility of being in healthcare, dealing with an end user who continues to be sicker, more highly acute, more confused, more vulnerable, more demented, and again, more and more and more and more confused by the day. So those who have identified that we need a change have been very embracing, but you will be surprised. Sometimes our very own colleagues, which we are trying to really rescue from this long time broken system, are the ones that are fighting us the most. I think sometimes people they fear change and they focus on what's going to change rather than what they're going to gain. So when we first started, I got to tell you, Jerry, when we first started, the resistance was heavy. The resistance was heavy because many have tried, right? And very few, if any, have prevailed. So many of our colleagues, or our competitors, I will call them. I don't even think we have competitors. I think we have colleagues, and we can't possibly treat every patient ourselves. We just have people who happen to do the same thing that we do, perhaps not as well. But anyway, that's another story. But what I want to make sure that I do is that our disruption makes the entire industry change their ways. At least start thinking differently. My goodness, if we can say, hey, maybe the system can improve. And what we have done is we've attracted change agents into our practice. People who are thinking the following. First of all, the best days of healthcare are actually ahead of us, not behind us. People who want to change the habits of yesterday and help us create the new healthcare reality of tomorrow. But most importantly, people who have made a commitment that all of that the sweat and blood and tears and sleepless nights that all of us healthcare workers have to do, because it takes anywhere between 8 to 12 to 16 years to become a fully credentialed clinician, that all that effort is not made in vain. So we are looking to make sure that people come here and realize that we want to leave healthcare better than we entered it. And that's really our legacy, Jerry. We want to leave healthcare better than we entered it. So in a nutshell, we've had the entire system, I think, is starving. They're hungry. They're ready for a change. The unfortunate part is that it's taken people longer and longer to realize the need of that change. But I will tell you, the inflationary period is having people understand, whoa, 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 maybe my healthcare needs do have to be value-based. Maybe my healthcare needs do need to be identified, that I need to go to a provider who actually wants to make me better. And if I'm going to a provider that just gets me worse and worse and worse and puts me on 10 medications, and their only response is take another pill, which disrupts another body system that you have to take another pill for, this vicious cycle that only gets our population worse and worse year in out. If you are looking to say, what, I got to stop this vicious cycle, I got to get off this train that seems to be never ending and actually join the Bedrock theme, the Bedrock mission, the Bedrock brand to actually change healthcare and leave healthcare better than we entered it, those are the people that we're trying to get. So again, it's been a battle, but I got to tell you, in 2 years that we've been doing this, or 2 to 3 years, I got to tell you, Jerry, people are starting to come around more and more daily. More and more daily. People are coming to us either wanting to work with us, people wanting to partner up with us, and people who see what you guys are doing it the right way. So that's why we're very, very prominent on social media. We're very, very prominent with our communities. And I'll tell you one last thing, Jerry, that's important. We realize that not everyone's going to want to come and change healthcare. There are people who, no matter what you do, are going to want to stay where they are. And I made it a very clear expectation of my team. And I made this a proclamation. If there's a partner that doesn't want to change, if there's a partner who's happy with having massive falls every month, if there's a partner who is okay with the status quo, if there's a partner who, despite the rising acuity of our patients, continues to say the same thing, if there's a partner who wants to change the game by doing the same thing over and over again, which you and I both know it's insane, that's not a partner for us. And Jared, we've been very upfront with partners, colleagues, staff, and said, perhaps we are not for each other. And that's okay. But we are willing to make tough decisions when, if you come in here and you're a member of Bedrock and you have a Bedrock name tag, you are automatically a change agent. You are a disruptor. You are a contrarian, and you have to almost unlearn everything you've ever learned and start thinking of a new way of taking care of patients. Patients are getting less and less care every single day. The average physician visit is 5 to 7 minutes. In 5 to 7 minutes, I have to make sure that I look at your medications, all your other specialists, and actually address your concerns. But we're asking our doctors to also see more visits, to also see more patients, to actually travel. Again, it's an impossible, unsustainable, broken system that we are ready to end today.
Yeah, Doc, thank you so much for what is truly an inspiring and intriguing story. I want to take a step back, and you kind of you mentioned it earlier, kind of the COVID era brought some additional awareness to you. But let's look back. What was that one spark that led you to take this huge leap in your business that really, I mean, resonates with the entire industry? Let's talk about
Oh,
that.
I remember as clear as day, as clear as day. So I had a patient a long time ago, Jerry. I want to say back in 2006. And this lady, her name is Connie White. Connie White, and she has been my inspiration my entire career. And Connie White was a 92-year-old little beautiful lady in one of my communities that I went to in Manahawkin, New Jersey. And I remember going in to see Connie White in an assisted living, and Connie White was in the memory care part of the community. And Connie White was a beautiful, beautiful lady who I went to do an assessment. And at the time, Jerry, I did not know how to take care of patients with dementia, with patients with Alzheimer's, because most of my colleagues were not trained to deal with dementia because we're told that there's no cure, there's no treatment. So I go in to see Connie White, and Connie White, I wanted to see how strong she was in her upper body, right? So part of our assessments is we're looking for our patient's strength. And I remember Connie not reacting, not responding to me. And then I asked her a few times again, "Hey, Connie, can you? I want to see how strong you are." So think about this: a poor lady in an assisted living, in a memory care part of the community, with this new person. And again, I've always been a big burly guy, so I'm like standing over her, and I'm giving her multiple commands without even introducing myself, right? Because that's what healthcare's fast. I got to get in and out. And Connie said the following to me, Jerry. Finally, after I'm asking her 3 or 4 different times because I have other patients to see, I said, "Connie, I need to see how strong you are." So she goes, "You want to see how strong I am?" And starts and clocks me, punches me right in the face, Jerry. And I remember being startled, and I remember standing up, and I remember going like, "What the heck just happened?" And then I went and spoke to the nurse, and she's like, "Oh yeah, yeah. If you would have came and communicated with me, I could have told you that. Connie's combative. She's feisty." And I'm like, "Oh." And then if you would have read the chart, you would have seen that the last clinician who saw her, you would have seen her specialist this, you would have seen her last labs. And I'm like, wow, they're right. We have such a fragmented healthcare system. People don't communicate. And here I am as a young clinician trying to see Connie and trying to get Connie to do something, not knowing anything about Connie. So what I did that day is I left with my ego on the ground, and I said to myself, if I'm going to be viable in medicine, in healthcare, I have to start doing it right. So I began my mission I wanted to communicate with my nurses, my colleagues, every colleague. I wanted everybody to know what I was doing. I've been a patient. They call it holistic care, right? When it's comprehensive and everybody's in loop. But I quickly found out, Jerry, that that's not how healthcare is practiced. People don't communicate. People don't respond. So here it is, Connie. Connie needed the help of the entire medical team, of the entire healthcare team. But because we are so disjointed and outright dysfunctional, we are providing such a terrible service to Connie. That was the start of the journey that I'm still on, Jerry, which was I became enamored and I became, quite frankly, frustrated. And I said, rather than complain, I'm going to find a solution. And the solution is to create a system where the minute I see Connie, I know everything about Connie. I know what she likes. I know her habits. I know her family. I know her providers. I know her current status. And I know so much about her that it creates such an incredible exchange of abundance in that interaction, and I actually provide her great care. And unfortunately, that scene that I played out to you with me and Connie in 2006 is being repeated over and over and over in every physician, therapy, skilled nursing hospital all over the world.
Yeah, you look historically at the doctor-patient relationship, and I can remember as a young man, your doctor was a part of the family, right? Knew all about you, knew all about your family. There was definitely that relationship there. The industry has kind of evolved, as you said, maybe time spent with the patient is limited because of the doctor's own schedule and, well, the
Well,
staff's schedule. Yeah.
it's the schedule, Jerry, but also the incredible amount of paperwork. The doctor has to do so much paperwork. I call it digital bureaucracy or clerical bureaucracy, so much to just get paid for that visit. That visit is probably the 1% of our day to day. 99% of what we do outside of that visit, which a lot of it is beyond our control, is really what keeps the lights on in a community, I should say in a practice. But you hit on one point that is so this makes me sick to my stomach. You're right. In the 1940s and 50s, our grandparents, the same person, the same physician who delivered them, right, by birth, sometimes handheld them during the last breaths of life. And that doctor to patient relationship, you're right. We developed such a continuous relationship with that patient. They knew everything about us. They almost knew exactly what was wrong with us before we did. And unfortunately, we've lost that. Specialty care has become the high reimbursement and the sexy specialties to go towards. Primary care is not primary care anymore. It's secondary, tertiary, and sometimes an afterthought. One thing that we found out during the pandemic, Jerry, is that the people over the age of 75, I'm sorry, over the age of 65, 75% of them did not have a primary care physician. Think about that. We live in a world where 80% of our patients have chronic care needs. We live in a world where 80% of our patients are using the ER and urgent care as primary care. And we live in a world where not having a primary care contact ravaged that population during the pandemic. So again, it's such a tremendous need, and for us, it has become a our biggest problem and conundrum to tackle, which is we have to be able to solve the relationship that a patient has with a physician at bedside.
Absolutely. Absolutely. But I'm going to change gears just a little here, more from the standpoint of your business model. You had talked earlier about some challenges that you had faced. Can you be more specific? Let's share one or two significant challenges and how did you overcome them?
So I think one of the biggest challenges that a private practice, especially a multi-specialty medical practice changes, multi-specialty medical practice faces, Jerry, is really bringing in the right people. I think that's ultimately the biggest challenge for us. We can have a great vision, a great mission, a great brand. I can get on and talk to people like till the cows come home. But ultimately, the people that we have are the ones that execute and really create the dramatic results that we have out there. And so attracting the talent is a challenge. But I got to tell you, Jerry, we haven't had any difficulty attracting the right talent because of one overarching factor is, and that's our culture. We have an incredible culture. And I always tell people tell me, Andre, how does Bedrock have such a good culture? Is it you? Is it because you're so charismatic? Is it that you guys are paying them more? Quite frankly, we pay them just as much as everybody else pays them, right? The salaries are the salaries. The reimbursement is a reimbursement. The job is the job, right? We're taking care of the same patient. But I think something that we have unlocked, Jerry, is that when you treat others how they want to be treated, magic happens. And I think a lot of people say, I'm going to treat others the way I want to be treated. And that's a mistake because for example, I like people who are honest, direct, quick, and sometimes abrupt with me because that tells me how you feel. But not everybody likes that approach. So I think we really have to learn how others want to be treated, especially this day and age where feelings are a big, big thing. And mental fitness and emotional awareness and emotional intelligence has really presided over anything else. Sometimes even more, you can have a lot of letters after your name. Your resume can look amazing, but if you can't talk yourself out of a paper bag, it's really difficult for you to succeed in life. So our culture is one that we take care of people proactively. So, and I remember when we first started the practice, that was my dream. My dream is that this was going to be, we were not going to think of the patient first. We were not going to think of the payer first. We were going to think of the provider, the clinician, the human being, the person who is ultimately in charge of making those clinical decisions. My number one objective, and this, everybody knows this, Jerry. My number one objective, we call it a valuable final product for Andre Gomez in this practice. Just because I'm the president and CEO doesn't mean that I get special treatment. But my one accountable factor that I need to deliver on every single day is to make sure I have happy staff. People need to be happy because it is my job to strengthen their future, to protect our progress, to protect their territory, to use adversity as advantages. But the only way that I can do that is if I make them happy. And sometimes making people happy, we tend to think that it's money. We tend to think that it's days off. We tend to think that it's salaries. It's not. It's sometimes having successful confrontations. If something having productive arguments that are healthy, or sometimes sending a text message to someone and saying, "Hey, I'm thinking about you. Hope you have a great day." Sometimes it could be as easy as sending someone a motivational quote. Sometimes it could be as easy as saying, "Hey, Jerry, let's go get some coffee today." Sometimes it could be as simple as, "Hey, I see that you're having a tough time lately. I see that you're a little, I feel that you might be a little distant. What can I do for you?" Again, we've lost such grasp with empathy, right? And understanding that sometimes you just got to ask questions, be a human being, and just identify with people. We're so focused on profits and profits and profits. But I always tell people there's a way to get profits when you instill two things in people. And one is flexibility, and the other one is freedom. Flexibility and freedom. If people are given the flexibility to do things, meaning that you don't pigeonhole them into doing it just one way, these are smart, educated people. You got to give them flexibility, which is autonomy. And then you give them freedom, right? Which is autonomy. The profits will come because people will surprise you, Jerry, when you hire talent and you vet that talent, and then you get out of the way of that talent. That talent would absolutely wow you. So for us, it's been really the culture that we have created. And I'll be honest, Jerry, our culture sometimes is one of really high accountability. I I challenge people. I challenge people, and there are a lot, and I'm not happy to say it, but there are people who unfortunately have to move on from our practice. And again, I always say no one has come here and signed a lifetime contract because you have to continue to evolve. You have to continue to change. If we're change agents and we get comfortable and complacent, then what good are we? And I tell my staff there are three people in the world, those who make things happen, those who watch things happen, and those who say, "What just happened?" And at Bedrock, we happen to be the former. We make things happen because I cannot allow our practice to be affected on any of its abilities to serve our patients. So yes, sometimes we have tough conversations. Sometimes we have to restructure some of our plans. I always tell people is not, we don't pause. It's everything is a progress in motion. Nothing is an expiration. Everything is an evolution. Nothing is a burning. Everything is a stepping stone. But most importantly, Jerry, no matter what, no matter what, we continue to elevate our standards. We continue to elevate our standards. And I tell everybody this all the time. Sometimes when you're running a medical practice, sometimes when you're anything in business, we tend to lower our expectations. And I say to them, I will never lower my expectations. Never. We continue to do what we do, and the level of expectation always continues to rise. If anything, I have an elevated perspective, and I tell everybody who I hire, Jerry, I tell them one thing: how bad do you want your future to be the success that you have in your mind? How bad do you want it? How bad do you want it? And if you don't want it bad enough, and one thing I tell everybody, Jerry, is I can never want it more than you want it for yourself. If where my want for your future success overrides your want, then that's when we have an unfortunate, what I call an inflection point, where we unfortunately have to part ways. But it's been the people. So that's one of the things that I think has been a challenge, the people. And the other one, Jerry, and I think you what I'm going, is the over proverbial, perpetual moving target of insurance reimbursement, where they're constantly changing the rules, whether it's Medicare cuts, Medicaid cuts, Medicare Advantage cuts. Last week, Humana cut 10% of their recipients. Almost 600,000 lives are there searching for insurance. Reimbursement delays, untimely filings, meaning that insurance doesn't credential us on time, or we don't bill on time because of they're putting obstacles and we don't get paid. Pre-authorizations, denials, and again, we're dealing with a highly inflationary period. But again, I don't want to sit here and not give you solutions. Here's a solution. Just like I gave you a solution for the people, you just got to build the right culture and cultivate that and feed it and water that grass, right? The grass is always greener on the other side. No, the grass is greener where you water it. And the solution for us with the reimbursement challenges has been we have a very diversified multi-specialty medical model, Jerry, where we have 10 different ways to bill our patients. So that has created a recession-proof, bulletproof way to really handle a lot of the unexpected insurance cuts, and as that process continues to be a moving target. And again, so if I can think of the two challenges that we faced in the last couple of years, is definitely getting the right people, maintaining the right culture so they continue to be always accountable to themselves and to the team and ultimately our patients. And also from a vertical level, making sure that we stay ahead of these predictable and sometimes unpredictable changes of insurance.
Great. Thank you, Doc. I'm going to switch gears again on you. I want to talk about you. And you are certainly passionate and totally engulfed in this business model. And that's great to see. But I want to take this in a different direction. How do you maintain a work-life balance as a business owner? And do you have any like personal rituals or habits that keep you motivated and focused?
So I will tell you, Jerry, that's a great question. How do I stay motivated and what's my work-life balance? So I will tell you, those are two different answers. So I think, or maybe not, right? Maybe that's goes in hand, but I'll kind of unpack it a little bit separately. So for me, I'm not a big believer in work-life balance. I'm a big believer in what I call work-life blend. I think especially when you're in home in healthcare, you're always going to have your personal life kind of blend in to your professional life. And quite frankly, anybody who needs work life balance or needs to escape the everyday, you're not in the right job, or again, it's mundane. I love what I do. It's a calling for me. It's what I was born to do. Taking care of patients, taking care of people that take care of patients, and finding ways that we can do it better, more efficiently, more effectively, and at the end of the day, be able to have this be the way that I feed my family. It's a beautiful, beautiful thing. And again, it never goes there's never a day that goes by that I don't realize that the livelihood of thousands of people is on my shoulders. And I love that. I love that, where a lot of people might be stressed about that. A lot of people might be concerned with that. I love that challenge. And again, I also recognize that healthcare medicine is a 24/7 business. So it's something that I don't really need escape from. For me, again, it's having that work-life blend. I happen to have an incredibly supportive wife, have an incredibly supportive children. My family understands the passion that I have for what I do. I love it. I always tell everybody, Jerry, my days, I wish I had more hours in my days, because I'm always thinking about what we do. Some of my best ideas happen on Saturday and Sundays while I'm sitting at home, just reflecting on how can I improve the business. So I'm more of a work life blend person. My family means the world to me. I think I spoke to you in the early pre-screening, just my time with my kids, my time with my wife, spending time with those that I care about the most. That's what feeds me. It really keeps me full. A lot of people tend to be glass half empty, glass half full. I'm a glass overflowing kind of guy. I think that our biggest fortune is our life. And I think just the mere factor that we get to do what we do in this beautiful nature, to me, is something that I'm very thankful for. But if I can tell you what I do to stay motivated, 100,000% the gym. I go to the gym 4 or 5 days a week, sometimes more if I can. I've done that my entire career, my entire life, I should say. I started working out when I was 12 years old. I remember my aunt had these weights, and I said, okay, I told my brother, okay, so in 2, 3 months, we're going to be built, because I thought that all you need to do was lift weights for a couple months, and all of a sudden you look like Arnold Schwarzenegger. But again, it became a lifestyle for me. I've always been in sports. I've always been an athlete. But what the gym has done for me, it's a tremendous mental calibrator. It calibrates my mindset. I know that if I'm stressed, I go to the gym and my stress is gone. If something hurts, I go to the gym, it goes away. If I'm worried about something, I go to the gym, it goes away. The gym has been almost my therapy. During the pandemic, we built a gym downstairs, and we kept on working out. My wife and I, she's also very much into liftings. And if we we want to turn it back into medicine and healthcare, there is no more powerful, there's no more powerful anti-anxiety med than exercise, Jerry. And there's no more powerful anti-anxiety medication than exercise, with virtually zero side effects. And what it does for me, it gets my mind right. It makes my body right, obviously, because I feel strong, I feel functional, I can play with my kids, I can still be very active. So the gym really has been, it's like my secret weapon. And I always say, when you see someone else who practices what they preach, right? If I'm going to be the one promoting the wellness and the value of a multi-specialty medical practice, I have to look the part. I have to act the part. And I think the credibility and the integrity behind what we do, it gets a little bit higher notch, because the person who is the face of the business driving it believes in it, that he is, again, using that, what I'm preaching, I'm practicing every single day. And I think it creates more value, creates more credibility, creates more engaging, more embracing from the staff, for the patients, everybody involved. But yeah, the gym to me is a secret weapon, and it's something that I don't use an excuse. I go on Saturdays, I go in the mornings, I go at night, I go in the afternoon. There's not a point in time, and I'll never relinquish going to the gym, because for me, it's not even it's just part of like brushing my teeth and getting up in the morning. I got to go to the gym.
Part of a great routine, right? A positive routine.
Absolutely.
Yeah. So you've got so many things going on. What's next? What's the next chapter look like for you and your business?
That's a great question. So one of the things that and I'll give you the short answer, and I'll give you the longer answer. So the short answer is to really continue to grow where we are right now. So right now we're really growing New Jersey, we're really growing Delaware, we're growing Florida, and we're growing Nevada. Four regions that are very, very stable, very, very good markets, from providers, from partnerships, from colleagues, from insurance reimbursement. Those four regions are very, very, very viable for us. So continuing to really grow those four regions and build a business, a profitable business that will allow us to make decisions on growth in the future, whether it be new regions, whether it be new ancillary services, whether it be bringing on specialty services, whether it be investing in the technology of what we do, and so on. So really, really grow from where we are now. On a broader scale, Jerry, there's one thing that I've been working on behind the scenes, and that's, how do I bring AI into medicine? How do I continue my disruptive path in healthcare and medicine and make sure that AI becomes an ally of medicine, not a foe? One thing that has frustrated me for years is that AI has been part of our everyday life. We've been using AI since the 90s. Mortgage lenders have been using AI since the 90s. The credit check, right? Your credit score that came out in the 80s, that is all AI, right? We've been using AI in so many parts of business, but it's always eluded healthcare. It's always eluded medicine. I'll tell you why. Because the provider somehow has this warped mentality that AI and the humanoids that you see in Terminator 1 and 2 and 3, somehow they're going to come and replace us. And the fact of the matter is that technology will never replace the healing human touch, right? Technology will never replace that physician who has to deliver the bad news to that family member in a way that is empathetic, right? Technology will never replace that. Our hospice patients that we have to really, that palliative aspect and the terminal health, technology will never replace that. However, what technology can do is it can make physicians' decisions faster, more expedient, more effective at bedside. I call it making data-driven decisions at bedside. That's the best care. Technology can also allow a physician to go into a room and know everything about Sally, know her labs, know her medical records, know her recent hospitalizations, know her recent physician visits. It can arm a physician with every type of medical journal, every radiology, every diagnostic, every evidence based practice that exists out there. It can arm every physician. Think about, Jerry, think about a physician that you go to having access to the entire medical journal, entire periodical, entire randomized controlled trials, everything. So when you go to see a doctor, they give you the best course of action for you. One thing that I refuse to accept as norm, and we have accepted this as the norm because I think sometimes again we don't think critically. We've accepted the fact that if we go to a doctor and they don't give us what we want to, they don't give us the right answer, or we want a different answer, that we are entitled to go to get a second, third, fourth opinion. That is to me ludicrous. If you go to the right doctor who gives you the right information, who has access to all of the available data, you only have to go to one doctor. And then you spend time getting care. You spend time getting ahead of the problem. But all these people that get second, third, fourth, fifth opinions, by the time you get to the fifth opinion, unfortunately, you're dead in a lot of these instances. So my job, my future goal is to create an environment where technology, AI, allows physicians to do medicine, not practice medicine, do medicine. I think we've taken the word practice a little too literal. Practice in medicine doesn't mean I'm going to practice one thing one day. Oh, that didn't work. So next day I'll do this. Oh, that didn't work. No. Practice in medicine means you at first do no harm, right? That's the Hippocratic Oath. And by doing that, you have to arm yourself with all of the information so you can make a very focused, precise, personalized, tailor, accurate medical decision the first time and allow the bulk of the time to be spent on recovery. Recovery, not create this reactive model where you're sick, 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 sick in perpetuity. So that's my bigger goal, to create a technology platform that will allow a physician to maximize the level of care at bedside. So I have been working with a few teams to make sure that we get that either through an EMR, either through a virtual concierge type of a model. But that is my goal right now. The systems that are available for physicians and healthcare providers are good for one thing, and that's two things. It maximizes accountability to the regulators, and it maximizes accountability to the insurance companies. But it was the I call it EMR, EHR, so electronic medical records, electronic health records, and all these softwares were done to doctors, were done to patients. They weren't made for doctors or for patients. There's a difference. And my mission has been to make sure that we create a system that is for patients, that is for doctors, so we can provide better outcomes for the entire healthcare system.
That so resonates in what you just said. The whole idea of second and third opinion, but boy, does that make perfect sense. And what a simple model, right? If we can gather all that information and we have the cutting edge technology to do that almost instantaneously, what the absolute best
Absolutely,
treatment is at that time. That is amazing.
Jerry. We have the ability to provide 31 million medical journals to every physician around the country, right? Every physician can have access to all of that and basically in their hands. So now, if Jerry, if you come in and let's say you have a weird mole on your left hand, I can take a picture of that mole and within seconds, AI can compare to every single picture out there or every mole that's ever been in existence in our claims data and tell you if that looks abnormal or not. Then think about that. But right now, what we do is I see that, I don't know, okay, what? You need to go to a dermatologist. So, okay, so you go call dermatologist, you got 3 or 4 months to wait. So then you go make that appointment. Then you go see the dermatologist and they tell you, okay, we got to send that out. So now they send that out. Now, 6, 7 months go by. What if it is something that is malignant? Wouldn't you want to just take care of it the day you go see your primary care physician the first time? Now you have 7 months to get ahead of it. That's my point here. We have to start really looking at technology as a complete enhancer of our services rather than be fearful of it and think that it's going to be a detractor because again there's a place in it and that is my goal. It's not a wish, it's not a dream, that is my goal. And as long as I'm around, I'll be I'll tell you, I'm going to bring it to fruition. And it's a platform that will allow physicians, clinicians, every aspect of the healthcare system to be more precise, to be more accurate, to be more expedient, and to provide a better experience to our patients. Because I've always said the most difficult, the most laborious journey we will ever take as human beings is the healthcare journey. And guess what, Jerry? It's going to affect all of us. All of us. We're going to have to take that journey. Unfortunately, we take it when we're older, demented, depressed, socioeconomically challenged. It's highly exploitable. And unfortunately, we make the wrong decision. I want to be the proverbial GPS for our patients that allows them to navigate the healthcare journey seamlessly, navigate the healthcare journey so they can avoid all the landmines and actually get better and enjoy your golden years with actual gold, not this warped mentality where I'm spending more of my time going to the doctor than I am going to visit my family, going to visit the world, do things that I worked my whole life to enjoy life, not to now have to be like, oh boy, my biggest source of day to day is a doctor's appointment. We gotta put a stop to that.
Absolutely. Well, Doc, you've brought some amazing awareness to me first, and I'm sure to our viewers. I'm going to end this with one question that hopefully you can provide some insight to some of those aspiring entrepreneurs out there. What advice would you offer them, the folks who are just starting their journey or their entrepreneurial journey, or they're facing challenges in their own business? What would be that core piece of advice?
That's a great question. So, what advice for inspiring entrepreneurs? And I'll tell you again, in my contrarian spirit, I'll give you a contrarian answer. A lot of people who start again in my footsteps, they will read books, right? They'll read motivational books. They'll follow people like Grant Cardone, Elon Musk, Simon Sinek, right? Tony Robbins. And then they read all these books and see all these motivational presentations, and they're like, "Why am I not successful? Why am I not successful?" And then they do it again, and they sometimes they get all these loans, and they're like, "Well, I read all the books, I know all the concepts, they get all these degrees. Why am I not successful?" And mind you, some of our most successful people that exist do not even have college degrees. Again, but I'm not even going to go into that subject. But I will tell you where the magic happens for a human being and an inspiring entrepreneur. And I think we're all entrepreneurs, bud. We're all entrepreneurs. We're all trying to build something. That's what an entrepreneur is, right? Someone who builds. And for you to build something, you have to build yourself first. And I gotta be honest, it starts at home. It starts at home. People always ask me, who are your biggest role models? 1,000% at the top of the list. My first role model is my mother. My mother, who again, I saw her, the epitome of sacrifice, selflessness, putting herself behind everybody else. Single parent, raising three boys, and she had to stress, scratch, and claw to get us where we wanted to be. Three college educated children, very successful, very motivated. But that lack and that scarcity really motivated us. But she always instilled value in us, Jerry. So my mother, right behind her, and not so much behind, is my wife. My wife, who is my rock. I always say she's the rock behind Bedrock. And I wouldn't be able to do anything without her. She is incredible. She is there during the good times. She's there during the not so good times. She is my consummate supporter, 24/7, my biggest cheerleader, my biggest leader, meaning that when things are not good, she takes charge. She's someone who commands our home and allows me to be successful outside of our home, someone who understands her role, respects mine, vice versa, but someone who I've been with for almost 20 years, and it almost feels like we're still in our honeymoon. So definitely my wife. And then right behind them is my kids. I have an 18-year-old boy who's in college, and I have a 13 and a 10-year-old girls, two girls, one entering middle school, one about to enter high school. And they're my biggest source of inspiration. Just seeing them grow up, just seeing them be so tough, and just seeing them be so resilient. They went through school during COVID. They had to go through the home learning. They, again, we're very, 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 very fortunate. And I'm not going to stand on this conversation and say that we have the struggles of what other people can have in perspective and being relative. However, just seeing how resilient your children are, and people who, again, they go from being completely dependent on you to them becoming these people who don't need you anymore, right? Like my son, he doesn't need me anymore. My 13-year-old is getting to that point where she's self-sufficient. So to me, quite frankly, my parents, my wife, my children, then my faith. My faith is really something that's very, very important to me. And whether it's religion, whether it's whatever it is, whatever you believe in. I happen to be a non-denomination Christian. I respect my faith. I respect the faith of others. I love the community that I'm part of as a Christian in my town. And that's something that, again, always calibrates me, always grounds me, and always makes me understand that there's someone in a very higher position that's an actual power, and that they actually determine our future. And sometimes we tend to create these gods that are not really gods, because God isn't in you, right? And I always say I believe in the person who created me, who lives in my heart every day, and who died for my sins so I can enjoy all the fortunes of life. So if you have, for any aspiring entrepreneur, if you're able to check the boxes on those four things, you are able to have great parental stability. And it doesn't mean that you listen. A lot of people have had really bad parenthoods, right? Childhoods, because of bad parents, right? It doesn't mean that you have to duplicate or duplicate your past. You can use it as a way to actually go the other way. So if you are content with your parents, if you have a strong spouse, and if you have a really good relationship with your kids, and then you're really, really happy with your faith, you can do anything you set your eyes to, Jerry, because then I believe in what's called the law of attraction, or whatever. Some people call it manifesting, some people call it affirmations, whatever you want to call it. But I happen to be a believer, and my life has been a testament of this, that anything we want in life, we can create. Anything that this creates, you will hold if you hold yourself accountable and focused on it. Because I happen to be a believer that when you visualize and you believe, you will receive. And it's inevitable. Inevitable. And I think what a lot of people do is that they talk themselves out of things. But your thoughts create your reality because it creates your action, it creates the life around you. Your thoughts create your behaviors. Your thoughts create the difference between a good day and a bad day, which is means your attitude. So I am such a, again, for me, that's why those four factors have to be in place for you to be an entrepreneur. But just imagine if if I have all this money and I want to create this business, or I get a big loan, but I'm going through a divorce. My parents won't talk to me. My kids are using drugs or worse. How am I ever going to be a successful entrepreneur? And then my faith is constant. I don't have good faith, so I'm constantly negative. I'm constantly commiserating. I'm constantly being not being thankful for the incredible gift that I have, which is my life. I could be in a paper bag and homeless, but if I have my health, and if I have the support of those four people, I can reinvent myself and create another life over and over again. So, again, that's my advice to people. Stop putting so much focus on all these social media influencers and all these people that you see out there, all these athletes that could care less about you, and all these other people. Yes, it's great for entertainment. But there's a reason, Jerry, that there are a lot, 75% of people who win the lottery are broke, in jail, or dead within 24 months. That's not coincidence because to become someone of value, you have to be someone of value. To become a millionaire in monetary means, you have to become a millionaire in spiritual beliefs. And that's really the way I look at it because once you become that person, for any entrepreneur, once you're able to align all the checklists that I said to you become such a person of value that now money chases you. Money chases you. Money is attracted to you. Value is attracted to you. You don't have to go chase it because you've become a beacon that attracts it daily.
Powerful, powerful words, my friend. Thank you so much for that. And well, we're getting close to the end of today's interview. Thanks again so much for your time, Dr. Gomez. It was great meeting you and learning more about Bedrock Healthcare at home and by your amazing personal entrepreneurial journey. One last question. How can folks get in touch with you to learn
Great.
more about you and your business?
Love it. I thought you were never going to ask, Jerry. People can go on our website, bedrockhc.com, bedrockhc.com. Our website has all the information. 609 526 4746. 609 526 4746. That is our practice line as well. And if not, I am on social media, on Facebook, on Instagram. I am on LinkedIn. You can reach out to me and have a conversation. I will talk to the wall if they will listen. But again, I'm always there to really counsel people on the ways to do things or validate if what you're doing is working. I said this to you last week, Jerry, when we first spoke. I used to be the most consummate, venomous competitor. I wanted to put everybody out of business and I wanted to do it all, honestly. And the pandemic in the last few years have changed me 100%. I want everyone to do well. I want everyone to win. I want everyone to do better. Even if I have zero direct gain from it, the fact that people are looking to do things better and improve is good enough for me. So that's been a passion of mine, and again, that's why I love having these conversations because any opportunity that I get, if this conversation between you and I, Jerry, changes one person out there, if it changes one person out there, then we have done our job because that creates a ripple effect, right? Because that person will change somebody else's and somebody else and somebody else's. So bedrockhc.com, 609-526-4746 is our practice line. Drop me a line, give me an email. We also have, again, a shameless plug, Jerry, but I would be remiss if I don't share our podcast. We have a very exciting podcast, The Bedrock Way. We are on Spotify, iHeartRadio, Pandora, all the ones that people listen to podcasts, and also very active on our YouTube channel, The Bedrock Way. And in that forum, Jerry, I invite every type of entrepreneur, healthcare, and just keep it relevant. And again, one of the things that I love, and my mom always said, I'll never be skinny because I love to eat. and I'll never be lonely because I love to talk. And believe me, I am really living up to her expectations and to her predictions.
Well, every word was amazing today, Doctor. So again, thank you so much for that. And that's the end of our podcast today. So to everyone watching, this is Jerry Cavella, and this has been From Dream to Reality, a Business Tale podcast. I look forward to seeing you in our next episode. Have a good day.